and better, and you'll see what that's about in a moment. Elizabeth McGlynn and her team have been studying what we do in the office, in the hospital, across all settings, thousands of charts, hundreds of hospitals, big and small. What's the answer? Well, we get it right about half the time. If you took it on average, all these diagnoses, all these clinical indicators, when you actually measure what we do every day, the outcome of the care we deliver everywhere but Jefferson, that is, when you actually measure it, we get it right 55% of the time. Your job, when we get to part 3, is going to be to fix this mess. And how you're going to do it is through the incredibly hard work of culture and social change, of self-evaluation, a serious look in the mirror and say, what systems are broken? What training do I need to fix these broken systems, to fix this mess? Okay, by now I hope many of you have seen this book, know about this book, so again, we can't give all the details. 1999, Institute of Medicine publishes Two Errors Human. You read all about it. President Bill Clinton held this up in the White House. Well, here we are 11 years later, and I'll show you what the evidence is. Here's the punchline. Every hour in the United States, 11 people die in an American fully accredited hospital from a preventable medical mistake. Here's the book that translates it all for you if you're interested, by my great friend John Nance. If you've never seen John give a talk, come to Jefferson. I have him come every year to speak to the entire third-year class. This book won Book of the Year award. Wonderful, wonderful book called Why Hospitals Should Fly. An incredible book about teaching everybody, not just doctors, nurses, pharmacists, physicians, hospital administrators, the core basics of crew resource management. My colleague Sanjay Kumar, a physician entrepreneur, a guy who read Future Practice Alternatives clearly and memorized it in 1988, built his own company, a company that created software to track and record medical errors, self-reported, so that hospitals and big group practices could figure out where those errors are occurring, do a root cause analysis, fix that mess, and move on and protect patients and improve the quality of care. A wonderful, incredible guy. So I'm really not here to sell a new book, although that would be wonderful. What I'm really here is to sort of, again, give you a 20-plus year perspective on the issues. In Philadelphia, the birthplace of our nation, the birthplace of American medicine, 6 medical schools, 3 of which are walking distance from one another, 90 Joint Commission accredited hospitals. Healthcare is Philadelphia's biggest business. So again, I just really wanted to share with you that I've been thinking about these issues leading up to today. I've been working on today's talk since 1988. That's basically the message.